Welcome to the ResearchWorks podcast, broadcasting live from the Oceania Academy of Cerebral Palsy and Other Childhood Onset Disabilities Conference 2026 in the beautiful city of Hobart, Australia. Join Dr Dana Poole and the ResearchWorks team as we bring you an exclusive series of interviews with visionary keynote speakers and leading presenters, captured right here amid the groundbreaking discussions and innovations shaping the future of disability research and care.
Welcome back, everyone. We're here at Conference Oceania Academy in 2026, Hobart, Tasmania. Hope you've been enjoying all of the conversations we've been having so far. It's just a beautiful conference, and it's been really tricky trying to pinpoint different topics to talk about. We really wanted to give you a breadth of topics and conversations, and I think you're really going to enjoy this one. I would love to introduce you to now our keynote speaker of this conference, Lynne McKinlay. Welcome to the pod.
Thanks for inviting me. It's great to be here.
Thank you for being here. Look, I'm so curious about your keynote. Your keynote is titled Hope Can Reduce Burnout and What You Can Do to Become More Hopeful. Everything about that title is appealing. But before we get into that in more detail about your keynote, I'd love you to give us some context about who you are and what has brought you to this place.
Oh, well, have we got a bit of
Big
time?
question. Yeah, let's go.
So my professional background, my medical background, I'm a medical doctor and paediatrician originally, and then paediatric rehabilitation.
Right.
So I became a paediatric rehab specialist pretty early in the days of paediatric rehab. It was a pretty small, very collegiate, wonderful group of paediatricians around the country. And I was a paediatric rehab physician and the director of the Queensland Paediatric Rehab Service for a long time.
Wow.
So we'd set up the statewide service in Queensland, originally for children with brain injury and spinal cord injury. And then we also then introduced the Queensland Cerebral Palsy Health Service, started treating children with cerebral palsy. We set up a statewide network. So that was really a wonderful privilege to work with those families.
Yes. And to be part of setting up those services that, you know, from a legacy perspective are still going on now and bringing together that multidisciplinary team is no small thing.
I'm incredibly proud of the work that we did, and I obviously had a huge amount of help from the other leaders in the service and support from the Royal Children's Hospital originally in Brisbane and the Department of Health and the Health Minister and the people that did support us to do that work. So I think that's one of the things I'm interested in as clinician leaders about how do you actually, you know, get the support to do the things you know are important. And that's, I guess, got me interested in leadership in general and what leadership skills are needed to be able to advance really important health work.
Yes.
And the other thing that happened when we set up the Cerebral Palsy Health Service is we realised there was a big opportunity for research to sit alongside clinical work. And Professor Ros Boyd, who you probably know and have probably interviewed before, was the leader of that group, and I was originally the sort of clinical lead for that. But Ros brought on board amazing researchers and an amazing body of work in research in cerebral palsy and childhood injury. With a really broad kind of level of different interests, I guess, in that research portfolio as well. So that was another thing that was
wonderful when it merges together. And yes, you're absolutely correct. Like Ros Boyd, as a friend of the show, has been on the show many a time. And we think about the work that's been done through the Queensland Health Service as well, and the collaborations and partnerships. It's really had a ripple effect to not just Australia-wide, but globally. So a lot to be proud of. And I love what you just said about leadership. It's not often something that we talk about a lot in health. I think it's probably more widely spoken about in corporate land. You know, there's those leadership structures potentially, but within health itself, there's been a little more dearth of information or training in this area. So I suppose in the things that you've been involved with, it's not just management of people, it's the leadership of people and teams, isn't it?
Yeah, I think so. And I think, you know, and fostering people's opportunity to develop different skills while they might be working in a clinical area. So one of the things that worked really well when we set up the Queensland Cerebral Palsy and Rehabilitation Research Centre, which is the big long name of that
yes
research centre.
Yes.
Was that sort of was very collaborative with the clinical team. And so the researchers were working in the clinical world and the clinicians were working in the research world, and that both were benefiting from that. So one of the things we know about, I guess, well-being and professional growth is trying out different things. And I'll talk more about that in a minute, but trying out different things and finding out what are the things are that sort of light your fire. And so when you've got opportunities to step into leadership or take portfolio responsibility for certain parts of the clinical work or have leadership opportunities or have research opportunities, picking up all of those.
Yeah.
Trying different things until you find what it is that you're good at or that you have something to offer in.
That's fantastic. And it's so vital. It's actually so important as part of your career progression, but also to try to find things that, like you said, like just light you up, because there are so many different aspects of health that you can be involved with, and surely there's something that will inspire you to want to push the field forward and want to do more. So bring us now to your talk.
Next step.
Yeah.
Yes. Well, what happened then was, we built the new children's hospital in Queensland and we transitioned the clinical services to that and the merging of the two children's hospital together.
Yeah.
And then we had the statewide sort of services happening. So actually coming to the conference has been wonderful because I've met lots of people who've been involved, that I've known and been involved with for years. And it's really been great for sort of remembering all those, I guess, happy relationships and achievements that we did together. And because I was interested in leadership, I then within the hospital was taking on more opportunities for stepping into leadership roles while still working as a rehab. Was still leading the rehab service for a while and then working as a rehab doctor. And so I started doing different, I guess, medical administration roles and became very interested in those, did some work in particularly children with chronic complex conditions, not only cerebral palsy. And we set up a nursing sort of statewide nursing model for caring for children with medical complexity. And I was involved in a number of other sort of big change projects at the hospital. And to cut a long story short, ended up doing another specialty in specialist medical rehabilitation. So I'm a medical rehabilitation doctor, but also now a medical administrator. And my current work now is I work at Sunshine Coast Health Service as the medical lead for safety and quality. So I only just really stopped, and I'm no longer doing pediatric rehab, but I still feel like a pediatrician and a rehab specialist.
I can see that.
Even though I'm not doing that work now.
Yeah, but you've been looking after teams. That's been the consistent thing that you have been doing throughout a lot of this time as the services have developed and morphed and changed.
And I love working with a multidisciplinary team. And that my current job is really great because I've got a really wonderful team around me. And so over the last few years, I've been doing a lot of work in medical education. I worked for a company that did a lot of medical education, particularly focused on safety and quality.
Sure.
But then we were doing a lot of work in well-being, which is where I get to this topic.
Yeah.
And we were doing workshops on burnout and some things to do with, I guess, open communication and safety and quality and things like being able to speak up for safety and training people how to do that. So communication skills and well-being was sort of increasingly what I was interested in.
Yeah.
And then during the pandemic, just before the pandemic, I had the opportunity to go to Stanford and I went to Tate Shanafelt's Chief Wellbeing Officer course, which is a internationally recognised training opportunity regarding clinician wellbeing.
Right.
And then the pandemic hit. And the education work I was doing then transitioned to sort of, online. And I was looking for topics to do. We were doing a lot of webinars and things like that in that education role that I had. And so the pandemic was, as we know, making everyone feel, pretty hopeless about, especially after it was getting into about the second year of the pandemic. And that's where this topic came from, because I was like, well, I've done this training. I've got all this knowledge, like read all the literature to do with burnout and clinician wellbeing. But, where does hope fit into that? So I sort of went looking then to see if I could find the connections.
Oh, I love the journey and the story that's brought you to that. Thank you for sharing that with us. It's always wonderful to hear about the context of why someone presents the work that they do. I love the story behind that. And talking about hope, what is hope? How would you define hope, I guess, is our first question.
Yeah. Well, so the person who did the original research and the first papers were published in about like 1991 or thereabouts. He was doing the work at the end of the 80s, is a psychologist called Rick Snyder.
Mm-hmm.
And he published those first papers. In fact, he didn't set out. It's really interesting because looking at some of the research going on here, he actually didn't set out to research hope. He was researching another question, but found that people were talking about hope.
Okay.
When he was talking with people about when things had gone wrong or they'd made a mistake and about making excuses. That's what he was actually studying. But he found they were talking to him about hope, and so then he got really interested in that and started doing some qualitative research, and then eventually did. Built a scale, and it became a scientific theory. And one of the really interesting, once it crystallized, I guess, into a scientific theory, it became apparent that while we think about hope as a sort of an emotional thing, that it's actually a cognitive thing.
Right.
So it's actually a cognitive ability to be hopeful. And there are 3 parts to it. This is according to Snyder's theory, which is still used today. It still stands, even though people maybe have made slight adjustments to the wording. And I won't give you the textbook definition, but basically what hope is that it's a cognitive sort of set, he calls it, where you've got goals or you can identify goals which are important to you, and then you can develop pathways from where I am now to where I want to be,
right,
to reach that goal. And not only do I identify pathways, but then I have agency to take a step towards that.
Right.
So it's quite a different
Very
thing.
Powerful.
Yeah. So it's these 3 things. It's about goals, pathways, and agency. And he talks about essentially pathways thinking and agency thinking to reach goals that are important to us.
I love that. I really, really love that. So how does that then reduce burnout? And I suppose what is burnout?
Yes. So, I mean, burnout is really there's 3. And so that's another pretty well understood concept now that was originally Christina Maslach's work. And then a lot of other people have done work in that space since. And it's really sort of a 3-part thing where we feel like a sense of exhaustion, a sense of lack of efficacy or lack of sort of professional ability sometimes.
Right.
And then the third domain is, and so those 2 are pretty obvious what they are. And the third one is what is called different things, but basically cynicism. And so, and this is really important and interesting when you look at clinicians, because that cynicism can come across as like depersonalizing language or making inappropriate sort of jokes or stereotyping or those sorts of distancing.
Yes.
So the clinicians are sort of distancing themselves from the human
interaction.
Of the patient.
Yeah. Okay.
And so that cynicism is probably in some ways the one that's really, very sort of can be quite morally damaging to us as well because when we feel like that, and there's probably quite closely linked to things like compassion fatigue.
Sure.
That when our compassion bucket's empty and we don't maybe treat the patients the way we would like to, then that gives us quite a bit of moral distress as well. So burnout, compassion fatigue and moral distress are all sort of linked.
Yeah.
But burnout is generally those 3 things. So in all the papers that I'd read early when I became interested in this, and when I went to that Stanford course and, read all the papers that have mainly been developed out of the US research looking at primarily doctors originally, although that's broadening now to more multidisciplinary.
Yeah.
But a lot of the original papers there wasn't any talk about hope in any of that.
No.
So I just thought, well, that seems, it seems to me that hope should be protective. So then and this is kind of embarrassing for a research audience because then I basically decided to go take my confirmation bias and go look for a bit of evidence that would support what I felt was
we all do
probably
it. Yeah,
there.
yeah.
We all do that?
We all do it. But then we find the evidence to support it. But yes, I mean, you think about...
Because you had a gut feeling, right?
Yeah, that's right.
You're an experienced person and you have gut feelings that you think are right.
That's right. And look, the fact that you know that there's confirmation bias is probably very protective. You know, that I would have my inklings and I'm aware that confirmation bias is a thing. So when I look into it, you also... you know that there's another side to it as well, and you're acutely aware of it. I think we all do it, but it's good. Anyway, so I digress.
But it's interesting because most of the papers that link hope and burnout are more recent, right? They're in the last sort of 10 years, certainly.
Okay. Mm-hmm.
And so, and they've often been with quite specific populations. So there's been a little bit of a cluster of papers recently to do with oncologists, so doctors working with cancer and patients with cancer, and there's been a bit of a focus of interest there. The reason I became really interested in it is when I've been doing my sort of medical education work, which was a sort of a sideline job, in the last 10 years. A significant sort of, I was doing half-time working for the health department, half-time doing education, so a significant sideline job. I was always interested in, like, there's no point giving people information if they can't do something with it. From an education point of view, there's got to be something that's practical.
That's right. Yeah.
Or that people can hear me talk or come to a workshop or whatever and then walk out the door and try something.
Some tools. Yeah.
Try something new.
Yeah.
So that's why I became interested when I sort of started reading about this, not only because of the links with the burnout, but also that there are some fairly simple, in some ways, practical things that people can do to become more hopeful.
Right.
And then I tried to look at the things that we know are important for clinician wellbeing, the sorts of activities or tools or whatever, and then look how that relate to goals, pathways, and agency.
Amazing. And I know there's a lot there to cover, but could you give us a bit of a snapshot, an idea of what some of these tools or strategies look like?
Yeah. And I think what's really interesting is, like, we know from the point of well-being, I mean, there's a lot to do with workload and work stress and maybe efficiency or inefficiency in work, and they're big things that sometimes hard to shift. But there's other things which are to do with our sense of meaning. Right. In the work that we do and being proud of the work we do. And really interesting, when you read the hope literature, there's a lot in there about dignity in work.
Profound word.
That we find dignity in our work. And so all of that comes through really strongly in both. There's a big thing about community, connection, belonging, inclusion. And so that's really seems to be really important in both as well. And then there's a big thing about how we actually, I guess, recover or share the load, or things like reflective practice or supervision or coaching and mentoring.
Yes.
So when I look at those three buckets and I think goals, well, as rehab physicians or therapists, we're probably pretty good at setting goals, but when it comes to personal goals, how do we break that down to something that's valuable and also I guess specific and not too easy, not too hard. It's a bit of the Goldilocks effect with goals.
Sure.
You want it to be intermediate difficulty for it to be a goal that we want to pursue.
Yeah.
And what helps you find that, and what are the sorts of things you can do, and that's where things like having a mentor, having role models, listening to stories of success can help you see what a realistic future might look like.
Yes.
So that's the goals part. There's other things as well. With pathways, I think there's a lot for us to learn from things like, design thinking and, brainstorming and creative sort of solution-focused kind of ways of moving from here to there.
Yeah. There's mind mapping activities,
all of that
and things
stuff
that you can, right.
And some of the tools we probably use with patients.
Sure.
How would we
us.
apply those to ourselves?
Sure.
Getting a big piece of paper or getting in a room with a couple of people that so that's where a peer group might come in.
Right, yeah.
And I belong to a peer group that I've been with for 6 years, medical administration peer group. And there's a lot of that goes on, helping us. Well, have you thought about this? Have you tried that? So different pathways.
Yep.
And then agency is really about my sense that I will do it. Not that I could do it, or not that I would like to do it, but that I will do it.
Will.
And I think there's quite a bit there also to do with like growth mindset and this idea of using a process to move forward and what you can do in that way. So I think there's a lot of, I guess, tools that we maybe already know about.
Yeah.
But if we really intentionally put them towards,
if
we're feeling hopeless about something, to really intentionally then try to say, well, what would make me, where do I want to be, and what might be some intermediate goals to get there? And what are some different ways to get to those
that
goals?
Place. Yes.
And, how can I actually make a concrete move towards it, which is that agency part.
Yes. I mean, I love that there's a structure around that. I mean, most of us love a good structure or a framework to conceptualize.
It is a framework.
We do, and we need that, right? Would you recommend that this is something that people do before they feel the sense of burnout? Is it something that you do proactively, I suppose, is the question?
So in the research that I've read, they talk about people with high hope people and, low hope people. So I guess if we're feeling that we don't have a strong sense of hopefulness for the future, what can we do to move ourselves from being maybe low hope to high hope?
Right.
And that was the thing that really attracts to me, apart from the fact that this is a cognitive skill, which I always think is great, because anything that's cognitive is something you can learn.
Yeah, that's right.
And
There's
that's what Snyder
there.
says.
Yeah.
It's you can learn it.
Yes.
You can practice it.
Yes.
You can get better. And it's not, and it's fairly enduring when you get there. So even if you're building up hope in, hopeful ways of thinking and acting in other parts of your life, that probably translates to learning those skills. So I think that's true. I think some of the things that we maybe underestimate the importance of in medicine and allied health and nursing is things like supervision, things like sometimes, stepping outside of your own laneway and seeing how other people attack a problem.
Yeah.
I've always been really interested in how industries other than medicine do different, approach a different problem.
Yeah.
And small, I guess, I mean, the other thing I think is I'll probably talk about briefly is, this idea of marginal gains, that you don't have to eat the elephant all at once. It's just all the little incremental things.
That's
and
right.
that builds hope because you have these little, pieces of success and
that's beautiful.
I guess confirmation about your own agency to make those steps.
And that's why setting those goals appropriately, as we would do for a lot of the people that we work with, is incremental and not too big.
Not too big, not too small.
Yeah, but something that still brings you forward for it. I absolutely love that. And I think it speaks to the value of, all of us who are listening. If you're a clinician, you're a researcher, wherever you might be, there's value in you as a clinician having been aware of this and actually being able to seek out mentors, supervision, like you just said, and the value of goal setting. That's wonderful. But also for supervisors as well, when you're having those opportunities for conversations, to put some of this structure in place as well to support your team. We can all do something, can't we? And it's important to recognize that if we don't, something that we would usually love to do, and from a profession and career perspective, could lead us to a place where you feel burnout, and we're trying to prevent that ultimately. I do.
I mean, I do think people tend to think about burnout as a bit of a binary thing. I'm burnt out or I'm not. And if I'm burnt out, I'm broken. And I don't feel that way. I think that if we start to feel that sense of exhaustion, that sense of cynicism or a bit of a loss of compassion, or that sense of being sort of not as successful, to take that as a warning sign and actually say, I'm feeling a bit, go to your supervisor, go to a friend, having a friend at work that you can talk about.
Yeah, great.
Talk to your peers. Try to actually, set those goals or find that thing that you might need a little bit of a sort of a diversion even to find that thing that re-energizes you.
That pathway. Yeah, that's wonderful. Thank you so much for sharing this with us on the podcast today. I'm glad that people who are not able to be at the conference get this kind of information and something that's just so practical for them. So thank you so very much. And for everyone who's at the conference, they'll be listening to this one again, I'm very, very sure. So thank you for everything that you've done. Thank you for sharing your story with us.
Thank you for inviting me.
Oh,
it's been a great pleasure. Thank you.
Wonderful. Thank you to all of our listeners. I hope you really enjoyed that. There'll be so much more to come still, so do stay tuned, but we'll talk to you all again really soon. Bye.